3 years into our marriage, we hadn't had intercourse. When we started to have intercourse, he said to me, in his words, it was like hitting a brick wall. You just don't feel, I get upset, you don't feel whole.
Vaginismus is a panic attack of the vagina, almost the same as someone who's having a panic attack, except they're having a panic attack in their vagina.
Vaginismus is a condition, it's not a disease, whereby the muscles of the pelvic floor, muscles around the vagina, around the rectal opening, around the urethra, gets tightened, gets narrowed because some sort of a fear, apprehension, concern regarding penetration. Therefore, it's making any penetration difficult or impossible.
I decided to wait to have intercourse when I got married, so I figured that was just a decision I made. I was nervous. I knew I couldn't use tampons. I was afraid to. And then when we finally got married, I knew that was a problem, but I didn't know what kind of problem that was.
She would tense up. She would just become, very afraid and tense, and for fear of hurting her, I would just stop and, we would talk about it for a little while, and both thought it was just fear of the unknown.
So I went to the gynecologist, which I've never done before either, and she couldn't perform a pap smear. She couldn't perform a test on me.
So vaginismus is a condition of penetration difficulties. The woman could arrive being absolutely sexually active in all ways but penetrative, what is called, she can do outercourse but not intercourse.
We were having sex, we were having, outer course. We would enjoy sex, being together, being intimate. We just did not have intercourse. That was the only thing we were missing. And of course, we both wanted to have children, so it was very important. That was a very important part to us, and to consummate our marriage.
It made me feel really bad. It made me feel bad about our marriage in our sexual area. You just shy away from it. You don't want to talk about it. You don't want to think about it because nobody really knows what you're going through.
Vaginismus presents itself at our office. It presents itself in all colors and all flavors. Single, in relationship, married, widow, divorced, regardless, young or old. The three most prominent reasons for vaginismus are not knowing about the body, religious upbringing with repression or disallowing normal experimentation with the body or a certain code of behaviors before and after marriage. And the third reason is the unknown.
My parents are strict Italian family. I come from a strict Italian family. And they always said, you wait till you get married to have intercourse.
Fear of sexual intercourse was ingrained in her mind, from the time that she was a child, that, you just don't do it. And all of a sudden now, some odd years later, she's being asked to, enjoy yourself. And it wasn't going to happen that easy.
For some reason, they're either afraid or their self-experimentation led them to negative interpretations of what happened. May there be fear of something that's not even realistic, but they were worried about it, and they stopped there. And suddenly there is this sensation of estrangement from the body.
Anything couldn't go down there. I couldn't even use tampons. I couldn't pick up a mirror and take a look at myself to see if everything was okay. I couldn't touch myself down there in any way.
Our body-mind approach is really trying to make you own your body again, not be afraid of it, not be afraid to experiment with it. We have to teach about the body, we have to show about the body, we have to show you how it goes, we have to demonstrate it to you. We have to reassure you that even if you feel some discomfort, it is part of the training. Make her comfortable in her own skin and genitals.
Many of our patients have no idea where the parts of their anatomy are in terms of the vaginal area. We have all of our patients draw a self-portrait, only it's not a portrait of their face. It's a portrait of their vaginal area. The reason we do that is we really find that gives us a clue what a patient knows in terms of their own anatomy.
We as female, it's hidden, it's inside, we don't touch, we don't look, and we're told not to either as well. So we teach the lady from surface anatomy, really knowing what she has, what it's like, how it's supposed to work, why it is, tremendous education, all the way to feeling what it's like to touch, to feel the outside as well as penetration in a graduated way. Worry, fear, anxiety, panic, any of those terms everybody uses, they are energies in the brain. They are mechanisms that have translations to bodily features.
I think the mind has a lot to do with what takes place in your body. I did feel, I guess, like violated by the medical profession. After a while, I mean, you just keep having exam after exam after exam, and how many times are you gonna look down there and tell me there's nothing wrong, or it might be a yeast infection, and here's some cream, go home, put some cream on it, and you'll be better. I guess I got in a panic, so to say, and then eventually I couldn't use the applicator anymore. Then I couldn't have a pelvic exam anymore, and it just got worse and worse and worse. After a while, you didn't want anything there. You know, it was going to feel good or not. You just were turned off.
There is such limited knowledge in the healthcare profession about that. So the women get the response of, it'll go away, just relax.
One of my gynecologists told me that I just needed to relax and calm myself down, and I should have a few drinks and get to it.
Or you don't love him enough, you don't try enough, you're crazy, we'll put you on antidepressants. We'll do some surgeries. There are a lot of misconceptions out there about this.
At first I was a little, you know, fearful, but then when, you know, penetration had occurred, it was like there was nothing ever wrong down there. He wasn't hitting a brick wall anymore. I was relaxed and ecstatic. When it was all, you know, when we had finished, it was unbelievable. I sat there and I just cried, and so did my husband. It was amazing.
Before Kevin found the Women's Therapy Center on the internet, I was definitely losing hope. When we first had intercourse, I finally felt complete. I felt like a grown woman who can do normal things.
Once we were able to have intercourse, and you know, it was a beautiful moment. It was an absolutely beautiful moment. I could literally feel the anxiety be left from Anne-Marie. She just felt very comfortable with herself from that point. About a month after therapy was complete and we were told to go home and have sex, about a month later, we found out Anne-Marie was pregnant. She's now 6 months pregnant.
It becomes her own journey with her own body, with her own fears.
Vaginismus is curable. Vaginismus is about life, not just sex.